cardiac, aspirin, salicylate, class, analgesic, NSAID, antipyretic, antiplatelet, action, inhibits prostaglandins involved in the production of inflammation, pain, and fever, dilates peripheral vessels and inhibits platelet aggregation by blocking the formation of thromboxane A2. Indications: ACS, such as MI, ischemic chest pain or angina, moderate pain or fever. Contraindications: GI bleeding, hemorrhagic stroke, gastric ulcers, asthma, hypersensitivity to salicylates, children under 12. Onset duration. Onset 15 to 30 minutes. Duration 4 to 6 hours. Dose and route. Adult. Mild pain/fever. 325 to 650 milligrams PO every 4 to 6 hours. ACS 2 to 4 baby aspirin equaling 162 to 324 milligrams, or 1 adult aspirin equaling 325 milligrams PO. Nitroglycerin, nitrostat. Class: nitrate vasodilator. Action: relaxes smooth muscle resulting in coronary artery dilation, meaning reduced blood pressure, preload, afterload, and oxygen demand. Indications: chest pain, ACS, pulmonary edema from CHF, hypertensive emergencies. Contraindications: ED drugs within the past 24 to 72 hours, head injury, systolic blood pressure below 100, cerebral stroke/hemorrhage, bradycardia, tachycardia, right ventricular infarction, and volume depletion. Onset duration. Onset 1 to 3 minutes, duration 25 minutes SL. Dose and route. Adult 0.4 milligrams SL every 3 to 5 minutes up to 3 doses equaling 1.2 milligrams. Meter dosing at 0.4 milligrams per dose. Max of 5 doses within 15 minutes. Pulmonary edema 0.8 for a systolic blood pressure above 160 or 1.2 for a systolic blood pressure above 200. Peds not recommended. Nitro paste, nitrobid ointment. Same until onset and duration. Onset 15 to 60 minutes. Duration 2 to 12 hours. Dose and route. Adult 1 to 2 inches applied to the skin, no hair. This is applied with nitro paper or tape. Epinephrine, adrenaline. Class: sympathomimetic. Action: endogenous catecholamine that directly stimulates both alpha-1, beta-1, and beta-2 adrenergic receptors. The effects this will have on the heart include increased contractile force, increased heart rate, and increased cardiac output. A potent vasoconstrictor and bronchodilator. Indications: anaphylaxis, cardiac arrest, asthma, bradycardia, first-in-line peds, shock not caused by hypovolemia, severe hypotension with bradycardia when pacing and atropine fails. Contraindications: hypovolemic shock. Caution should be used in patients with known cardiovascular disease or patients above 45 years old. Onset duration. Onset 1 to 2 minutes or 5 to 10 minutes SQ. Duration 4 to 10 minutes IM. Dose and route. Adult, cardiac arrest 1 milligram of 0.1 to 1 milliliter IV IO every 3 to 5 minutes, no max. Asthma anaphylaxis, 0.3 to 0.5 milligrams SQ/IM of 1 milligram to 1 milliliter. If no response, some protocols give 0.3 to 0.5 milligrams IV of 0.1 milligram to 1 milliliter. Post-cardiac arrest or bradycardia with severe hypotension. 2 to 10 micrograms per minute IV drip and titrate to effect. PEDS, cardiac arrest, 0.01 milligrams per kilogram of 0.1 to 1 milliliter IV IO, max 1 milligram every 3 to 5 minutes. Anaphylaxis, asthma, 0.01 milligrams per kilogram of 1 milligram to 1 milliliter SQ/IM with a single max dose of 0.3 milligrams. Norepinephrine, Levophed. Class, sympathomimetic vasopressor. Action, alpha-1 and beta-1 agonist, causing vasoconstriction and increased myocardial contractility. Indications, cardiogenic shock, neurogenic shock, hemodynamically significant hypotension refractory to other sympathomimetics. Contraindications, hypotension due to hypovolemia. Onset, duration. Onset 1 to 3 minutes, duration 5 to 10 minutes. Dose and route. Adult 2 to 20 micrograms per minute IV, titrate. PEDS 0.05 to 0.1 micrograms per kilogram per minute IV, titrate up to 2 micrograms per minute. Dopamine, Intropin. Class, sympathomimetic vasopressor. Action, acts on alpha-1 and beta-1 adrenergic receptors. Effect depends on dosage used. 2 to 5 micrograms per kilogram per minute may act on dopaminergic receptors, causing renal, mesenteric, and cerebral vascular dilation. 5 to 10 micrograms per kilogram per minute will stimulate the beta-1 receptors, causing increased cardiac contractility and output. 10 to 20 micrograms per kilogram per minute will stimulate the alpha-1 receptors, causing peripheral, arterial, and venous constriction. Indications, hemodynamically significant shock like cardiogenic shock, neurogenic shock, and septic shock, second-line drug for bradycardia after atropine. Contraindications, hypovolemia, trauma, tachydysrhythmias, VFib, patients with pheochromocytoma. Onset, duration. Onset 2 to 4 minutes. Duration 10 to 15 minutes. Dose and route. Adult 2 to 20 micrograms per kilogram per minute IV drip, titrate to desired effect. PEDS, same as adult. Amiodarone, Cordarone. Class 3 antidysrhythmic. Action, prolongs duration of the action potential and prolongs the refractory period. Also may have beta adrenergic receptor and calcium channel blocking activity. Works on both ventricles of the atria. Indications, VFib, hemodynamically unstable VTAC, treatment for some stable atrial rhythms. Contraindications, CHF, cardiogenic shock, bradycardia, second or third degree heart block with no pacemaker present, hypersensitivity to iodine. Onset, duration. Onset, within minutes. Duration, 30 to 45 days. Dose and route. Adult. Pulseless VTAC/VFib arrest. 300 milligrams IV IO, may repeat once at 150 milligrams. VTAC with a pulse. 5 milligrams per kilogram IV drip over 10 minutes. Max of 2.2 grams in 24 hours. PEDS. VTAC/VFib arrest. 5 milligrams per kilogram IV IO. VTAC with a pulse. 5 milligrams per kilogram IV drip over 20 to 60 minutes with a max of 15 milligrams per kilogram per day. Lidocaine. Xylocaine. Class 1B antidysrhythmic. Action. Sodium channel blocker that acts primarily on the ventricles of the heart during phase 4 diastolic depolarization, which decreases automaticity, suppresses premature ventricular complexes, and raises the VFib threshold. Indications. Significant ventricular ectopic with ischemia/MI. Pulseless VTAC or VFib cardiac arrest. Stable VTAC with a pulse. Contraindications. Prophylactic use in an acute MI, second or third degree heart block in the absence of a pacemaker, Stokes-Adams syndrome. Onset duration. Onset 30 to 90 seconds. Duration 10 to 20 minutes. Dose and route. Adult cardiac arrest 1 to 1.5 milligrams per kilogram IV IO bolus. May be repeated in 5 to 10 minutes at 0.5 to 0.75 milligrams per kilogram with a max total of 3 milligrams per kilogram. Bolus is followed by a maintenance infusion of 1 to 4 milligrams per minute post cardiac arrest. For PVCs or VTAC with a pulse, 0.5 to 0.75 milligrams per kilogram IV IO up to 1 to 1.5 milligrams per kilogram. May be repeated for a max total of 3 milligrams per kilogram. PEDS, cardiac arrest, 1 milligram per kilogram IV IO bolus followed by maintenance infusion drip of 20 to 50 micrograms per kilogram per minute. IV IO post cardiac arrest. For PVCs or VTAC with a pulse, 1 milligram per kilogram IV IO. Atropine sulfate. Class. Anticholinergic, parasympatholytic. Action. Inhibits actions of acetylcholine mostly at muscarinic receptor sites, causing decreased salivation and bronchial secretions, increased heart rate, and decreased gastric motility. Indications. Hemodynamically unstable bradycardia, organophosphate, or nerve gas poisoning. Contraindications. Tachycardia, hypothermic patients, caution in patients with active MI and hypoxia. Onset duration. Onset rapid. Duration 2 to 6 hours. Dose and route. Adult. Bradycardia 1 milligram IV IO 3 to 5 minutes up to a max of 3 milligrams. Organophosphate poisoning 1 to 5 milligrams IV IO IM every 3 to 5 minutes until cessation of bronchial secretions. PEDS, bradycardia not responding to epi, 0.02 milligrams per kilogram per minute. Minimum dose of 0.1 milligrams and maximum dose of 0.5 milligrams. Max total of 1 milligram for child and 3 milligrams for adolescent. Organophosphate poisoning. Peds under 12 years old, 0.05 milligrams per kilogram IV, IO, IM every 20 to 30 minutes until cessation of bronchial secretions. Adenosine, Adenocard. Class, miscellaneous antidysrhythmic, endogenous nucleoside. Action, decreases electrical conduction through the AV node without negative inotropic effects. It also acts on the SA node and vagal nerve terminals to decrease heart rate. Indications, SVT, PSVT. Contraindications, bradycardia, drug-induced tachycardia, second or third degree heart block. Onset duration, onset, immediate. Duration, half-life, 10 seconds. Dose and route, adult, 6 milligrams rapid IV IO push followed by 20 cc saline flush. May repeat in 1 to 2 minutes at 12 milligrams rapid IV push with saline flush twice. Peds, 0.1 milligram per kilogram, max of 6 milligrams. IV, IO, followed by 5 to 10 cc saline flush. May repeat in 1 to 2 minutes at 0.2 milligrams per kilogram, max of 12 milligrams, IV, IO, saline flush. Metoprolol, low pressor. Class, beta blocker. Action, blocks beta adrenergic receptor sites in the heart, lungs, and blood vessels. The beta-1 blocking action on the heart decreases heart rate, conduction velocity, myocardial contractility, and cardiac output. The beta-2 effects may cause bronchoconstriction. Indications, SVT, PSVT, AFib, AFlutter, to reduce myocardial ischemia and damage in an acute MI/unstable angina. Contraindications, hemodynamically unstable patients, CHF, decreased cardiac output, cardiogenic shock, second or third degree heart block, bradycardia, systolic blood pressure under 100. Onset duration, onset 1 to 2 minutes, duration 6 to 8 hours. Dose and route, adult 5 milligrams slow IV at 5-minute intervals. May repeat up to 15 milligrams max. Peds not recommended. Diltiazem, cardizem. Class, calcium channel blocker. Action, inhibits calcium ion influx through slow channels into the cell of myocardial and arterial smooth muscle. Slows SA and AV nodal conduction. Dilates coronary arteries and arterioles, thus inhibits coronary artery spasms. Indications, AFib, AFlutter, multifocal arterial tachycardia, SVT, PSVT, refractory to adenosine. Contraindications, second or third degree heart block, hypotension, cardiogenic shock, ventricular rhythms, sick sinus syndrome, Wolff-Parkinson-White syndrome, AMI, VTAC. Onset duration, onset 2 to 5 minutes, duration 1 to 3 hours. Dose and route, adult 15 to 20 milligrams IV, which is 0.25 milligrams per kilogram, may be repeated in 15 minutes at 20 to 25 milligrams IV, which is 0.35 milligrams per kilogram, over 2 minutes. Maintenance infusion of 5 to 15 milligrams per hour, titrate to HR.